Good morning, good afternoon, good evening, depending on where you are. My name is Diana Joseph. I'm the CEO of the Corporate Accelerator Forum. We are a group by and for corporate leaders who work with startups. And in the course of working on that relationship between the giants and the startups, we've come to really understand how important ecosystems are in fostering really any kind of transformation. I met many of the leaders here today when they appeared on my podcast, The Ecosystem Show, with my co-host, Michael Mangold. And on our Bulgaria episode, I was really inspired by the intentionality with which digital health leaders in this region are consciously constructing not only the Bulgarian digital health ecosystem, but its connections with the entire world. COVID has made it really apparent that we need more collaboration across healthcare systems. And so today we're kicking off a joint international initiative called Together We Make Digital Health Accessible, working outward from the Bulgarian ecosystem. Today's event is the first step toward fostering the connection among innovative healthcare ecosystems worldwide and opening new business opportunities through great startups working in this space. Over the next 90 minutes, we'll begin with some remarks from our guests, our illustrious guests, and our organizers. We are led by the US-Bulgarian Chamber in America and the Digital Health and Innovation Cluster Bulgaria. Once they've gotten us started, we'll hear from 5 Bulgarian entrepreneurs who are truly global ready. After the event, we'll be sharing a healthcare value chain with some very concrete and accessible digital health solutions that appear along the patient journey through Bulgarian companies. We expect that at the end of this conversation, we'll have time for 1 or 2 questions. So please feel free to chat your questions to us on whatever platform you're on as we go along. We'll choose 1 or 2 to address here live, and we'll follow up on any others. With that, I will turn it over to Liz Nestorov to introduce our first guest speaker.
Thank you, Diana, for the wonderful kickoff of the event and describing it. Hello, everyone. Good morning, good afternoon, good evening, wherever you are. Thank you for joining us today. It is my pleasure as the president of the US-Bulgarian Chamber in America to introduce our official start of this exciting initiative between the United States and Bulgaria in the digital health innovation field. And of course, we look forward to what's going to come out of it in the next few months to a year. But also with that being said, today we have a special guest joining us, Josh Marcus, the Honorary Consul for the Republic of Bulgaria for the state of Florida. And with that, I want to turn on to him. So thank you so much, Josh, for joining our event today.
Well, thank you, Elise. I'm honored to have been asked to be the first speaker in this event, just to welcome you, basically, as participants in this. As the honorary consul for Bulgaria for the state of Florida, part of what I do here is help businesses come to the U.S. to grow and prosper, as well as helping U.S. businesses go to Bulgaria to grow and prosper. It's a wonderful position to be in, and it gives me great pleasure to do that and to do things like this. Bulgaria is a tech entrepreneur's paradise in some respects. And healthcare in Florida is a huge business. And there is a lot of room for tech entrepreneurs to come to Florida and help healthcare systems grow and prosper and really just be a part of the ecosystem of the healthcare industry in one of the largest and most prosperous states in the Union. So with that, let me just say I'm thrilled that this is happening. The Bulgarian U.S. Chamber of Commerce is a wonderful organization. We are actually starting to have the Bulgarian U.S. Chamber of Commerce here in Florida also. We are beginning to have a structure that will allow it to grow, prosper, and obtain members in Florida. and it is a national and internationally powerful organization, which we are very, very proud to assist and help in its growth. So thank you very much all for being here. Let me pass it back to Elise. Thanks.
Thank you so much for your remarks, Honorary Consul. Thank you again for your time and joining us today. And with that, Diana and I will share responsibilities today. But let's introduce our next special guest that we have. That is Mike Ross, who is joining us from the capital of United States, Washington. Mike Ross has a great management portfolio in IT and some healthcare background. So, Mike, again, thank you for taking the time and joining us today briefly. Welcome.
Well, thank you, Elise and Diane and everyone. Again, hello for whatever time zone you're in. And so my name is Mike Ross, and I've been in IT for quite a number of years. Gosh, I'll say it's actually 30. So it's part of today. Pleasure to kick off today's event. This is a joint collaboration, not only between US-Bulgarian Chamber in America, but also the Digital Health Information Cluster of Bulgaria. So a couple opening comments. I'd like to provide some perspective. This event, aims to encourage, the connection between healthcare ecosystems worldwide. Stimulate that knowledge and exchange. Open the new business opportunities have been mentioned earlier. COVID-19 has shown us that this is really the right time to kind of work together, really on a much broader worldwide system, and to build effective and sustainable healthcare. There's a lot of savings that can come in from IT, and also accessibility associated with IT. So the quick thing in terms of perspective is that 20%, almost 20% of the U.S. economy right now is spent on healthcare. Now, the outcomes for healthcare in the U.S., it depends whether you talk at the very top end, and there's a tremendous amount of health innovation within the U.S. at the top end, but how is that made available for the entire population? So if you look at an entire population in terms of health outcomes, entire population, it's hard because the U.S. does not, at the top end, does the best in the world, from many people's perspective. From the broad, in terms of access for everyone, the indicators are lagging across many parts of the developed world. Yet we spend almost twice as much percent of our GDP in the U.S. on healthcare, as does the rest of the world, but we're not seeing that broad set of outcomes. So there is a role for digital health as a part of that, from areas that the U.S. government's already started doing. Not only is it looking at bringing into, for example, the Department of Defense, but once they saw the Department of Defense was working on a commercial system, based system, obviously with security associated with, like CERNA, then that also is now saying, well, what other parts of the federal government make sense to not just have the Department of Defense with a healthcare model, but then now that's been extended to Veterans Affairs and may go across many other parts of the U.S. government. So the answer is probably not to get one central source of digital, one digital system across the U.S. We're not going to be able to do that. There's too many out there. But how can you get all these systems to all work together, and how can you make access? So interestingly, parts of the federal government are already working on access, for example, for veterans. And although I'm familiar with that area and the fact that there's need for that kind of healthcare across the nation and be able to see access to records, there's a lot that can be discussed here and learning from other areas. So with that perspective, I hope that generates some interesting ideas. But so we have a great line of speakers today to talk through ideas and talk through sales solutions and what can be the right tool. I hope you enjoyed today's event, and we'll kick this off, the entire event, and wish everybody a great day as this all works out. Thanks.
Thank you, Mike. It's quite sobering, isn't it? The amount of money that we spend here in the US on healthcare, and yet we get these very different experiences for patients. The work of the ecosystem, the ecosystems, including government and including entrepreneurs, is just so important. Let's turn it over to our organizers, beginning with Eliz Nestorov.
Thank you, Diana. For those of you that don't know me, again, I'm Elise Nestorov, and I am leading the US-Bulgarian Chamber in America, which is headquartered in Washington, D.C. And as our first special guest, the Honorary Consul Josh Marcus stated, now we are operating full force in the state of Florida with headquarters in Miami. I'd like to first welcome everyone to today's event. It is the first of many to happen, and we are really planning a very exciting 2022, and hopefully where in-person events will resume. Of course, virtuals will still be a thing because it allows us to connect to anywhere in the world almost. Although a very young bilateral chapter, and as a chamber internationally, I want to say that we are growing fast at a steady pace, and we are really gaining our visibility here in the United States. First and foremost, our mission is to promote, enhance, and of course, develop those transatlantic economic relations, making each country more visible and popular and recognized in the other country's business environment. And that, with that being said, hence the partnership between the Digital Healthcare Innovations Cluster in Bulgaria and our chamber. As a chamber, of course, we'd love to have the members, we'd love to engage with our members. We're all about member engagement. And, while we still recognize that the strength of the team is greater than the strength of the individual, and choose to work with others to achieve collective success. That being said, partnerships like this, which we would love to see more often, nonprofits should definitely join forces. Distance shouldn't be an issue, of course, since we have all these virtual amenities available. And also, I want to say that, despite the ongoing, I would say we're still in an ongoing crisis with the COVID-19 global health pandemic, but the chamber was able to organize just for this year two in-person events. The Ready to Reopen event in Chicago, where we kind of approached the American Bulgarian business diaspora in Chicago, and we hope to return in next spring. And also in Miami, the kickoff event that we had in September. And in addition, other than just kicking off the event in Miami, we felt really welcome in the international community there. All the government agencies that are dealing with international business, including led by our honorary consul and his efforts there, had their doors wide open for us. So we can only hope for even better relationships next year. And with the strong team that we have on board currently, I know that they're planning really amazing programs and events for 2022. So with that being said, there are a few conversations on the state level here that we hope to bring in Q1 of 2022, worldwide expo opportunities in few industry-specific sectors, European agencies partnership, that's new that we're adding to our portfolio, so we look forward to those. And hopefully, if the pandemic allows us, also to do a trade mission to Bulgaria and maybe join forces with other bilateral chambers of commerce. And with that being said, I just want to say that the COVID-19 pandemic has really thrown several aspects of the health inequality, such as differences in the outcomes by race, ethnicity, age, profession, that we all saw, especially on the US side. And we saw that patients who are older actually have lower digital literacy, or they suffer from reduced access to digital infrastructure and have been disproportionately left behind by digitization in healthcare. So I think this event comes very timely, and I look forward to hear from the great speakers from all the companies in the cluster that we have today, and hopefully be able to provide solutions to US-based companies and worldwide. So thank you so much for joining us again. Thanks, Diana.
Thank you, President Nestorov. I think it's so important to make each country and really every stakeholder more aware of what's possible in partnering with the others. And the crisis makes this such a good time for that to happen. Next is Milena Stoicheva. She is currently CEO of JA in Bulgaria and chairperson of DHI Cluster Bulgaria. She's an executive with extensive national and international experience in the area of education, training, and entrepreneurship. Ms. Stoicheva, please take the floor.
Yes. Hello, everyone. Thank you, Diana. It's really my pleasure to be here today to speak at the opening of an opportunity, because I am an entrepreneur and an educator, and I do believe in the power of partnerships. So I see this forum really as an opportunity for both cultures and sectors in this space to get to know each other, and also to develop a closer collaboration that will bring value for both sides, on both sides of the ocean. Something that I really very strongly believe in and has been part of my life journey has been education, and I really see it as the basis of growth and the basis of building further the ecosystems, but also relationships. So when we established the cluster in Bulgaria, we really started in thinking how to create more value through the value chain in digital health and also in bringing more innovations in that space, seeing that this is really one of the most advanced and highly developing domains of knowledge, and also in the economy. And that is why we decided in our approach to really base our value proposition on two major elements. One of the elements, and I will start with in the different order. Instead of with technology, I will start with why we believe we have a good value proposition from the point of view of digital health ecosystem in Bulgaria, because of the people and culture. And a couple of points in this regard. Maybe you know, maybe you don't know, but I would like to point out that Bulgaria is one of the countries with highest percentage of women in STEM vocations in the world. In fact, in Europe, it is usually ranked first or second in terms of women participating in STEM and technology companies, and also being in leadership position in that role. So this is definitely one of our unique selling propositions that we are really ahead than some of the other countries. Another interesting point is that Bulgaria ranks second in the upper middle income group of the Global Innovation Index for 2021, and is also among the top 5 digital risers in Europe and North America. And this is really important because digital health and innovation is based a lot on the opportunity and the ability of also its workforce and human capital to take on such leadership positions, but also to take on, to develop this as entrepreneurial ventures. And last, as even a potential in terms of the younger force, we are one of the countries that is really competing very high on getting international in the International Olympics in informatics, with over 100 medals worldwide, and especially in the last 10 years has been one of the top performers in this regard. With the other element of our value proposition, and this is the technology and innovation capacity, what I can say for sure that the IT and digital sector in Bulgaria is really growing in terms of its GDP contribution, but also its rate of development. There are high-value technology solutions that are emerging from Bulgaria, and also a lot of technology startups that have been recently, also some of them getting IPOs in the US. There is also a variety of portfolio accessible digital health solutions from Bulgaria that are bringing added value also on a global scale. And I think we will hear some of the proposals that our entrepreneurs, members of the cluster, will present for you today. We have quite a few of the leading global healthcare companies that are operating in Bulgaria, represented in the cluster, and their a strong support in this space. And clinical trials, data, and digital are really key growth areas in the Bulgarian healthcare sector. So these are some of the opportunities where we see we can strongly add value to each other, and we can bring forward more innovations, also more solutions that are really in support of the well-being of the citizens in both countries, but also are the basis of economic development in the coming years of the current economy. I really appreciate this opportunity for our members to get to propose their solutions and innovative products, and I really look forward to expanding this and having more of these collaboration events. Thank you.
I did not know about these superpowers of Bulgaria, and I'm really glad to hear about it all. I would like to remind all the attendees to if you put your questions and comments into the chat on whatever platform you're listening, and we will be sure to address them. Thank you, President Stoicheva. Thank you, President Nestorov, for making this event happen. Our next guest is Sean Newton. As a seasoned public health and operational medicine specialist rooted in military medicine, healthcare information technology, healthcare policy, and medical education, Sean has had the great honor of providing consultative support for several governing healthcare bodies across the globe. His specialty areas include e-health reform, health information exchange, population health management, care management, and FWA. Sean, the floor is yours.
Thank you. Hello, everyone. I am extremely honored to have been asked to join you today. My history with Bulgaria is long and deep, as me and my colleagues have had many fun times discussing. But this is a fantastic opportunity to further some of the initiatives that I and my colleagues at Z Omega have pursued over the years. The wonderful work that we're doing as an organization cannot be done alone. It has to happen in concert, working with like-minded organizations, people, and especially those in positions of influence within government who can set certain standards and set certain regulatory demands of the industry to drive best practices forward. Now, if you'll bear with me for a second, I have prepared a couple of slides. I will try to share my screen and we'll walk through those things. Just give me one quick second here. Okay. All right. So as I said, thank you for the introduction. I'm Sean Newton. My role with Z Omega is the Chief Security and Compliance Officer, responsible for all of our accreditation certifications, making sure that we do the things that we're supposed to do for our clients who are payers and providers within the U.S. healthcare industry and the patients and members that they serve. I also serve as an ENAC commissioner, ENAC being the Electronic Health Network Accreditation Commission, making sure that the best practices are well supported across the healthcare industry in the U.S. I do want to introduce the Omega, tell you a little bit about who we are and what we do. As a company, we've been around for quite a long time, founded in 2021. We're comprised of about 500 employees, including expert engineers, clinicians, scientists, compliance nerds like myself. But we actually serve the U.S. healthcare industry with about 35 different health plans and different provider organizations. And the services and products that we provide serve as the basis for the facilitation of healthcare engagement for over 36 million patients, 36 million lives in the United States. We do have a partner, one partner. We are an independent company, but we do have one partner in Blue Cross Blue Shield Venture Partners as an investor. But we have several other companies that we partner with in order to bring the different things that we're trying to accomplish to fruition. Again, as a compliance nerd, I would like to highlight closely tied. I'm sorry, I'm hearing some background noise. Okay. We're closely tied to the regulatory industry in that we follow best practices as defined by several regulatory and accreditation bodies, some of which are on the bottom there, HITRUST, NCQA. We are a founding member of the Da Vinci Project, which is a collaborative of different organizations wishing to standardize best practices in interoperability and data exchange through standards like HL7 and FHIR. And then, of course, our relationship with ENAC also is very strong. So when we think about who we are as a company and the way that we engage the market, we really focus on, cultivating the culture of our company itself by having a robust set of experts across every facet of delivering the best products to the market that enable those who are providing or provisioning healthcare services to do the best job that they can and actually meet the triple aim. So within our organization, we have product engineers, product management, business analysts, project managers for implementation services, and of course, a lot of compliance across the board. I'll move very quickly through this, but why is this relevant to you guys? Why does this actually matter? We're not able to, at Z Omega, do the job that we're trying to do unless we have some very basic questions answered. Now, I would like to say that there's some similarities between the United States and Bulgaria, and there's some differences. I was fortunate enough to work very closely with some dear friends of mine over in Bulgaria who run a company called Gamma Consult. Gamma is the national EMR vendor for Bulgaria. Their EMR, or electronic medical record, is in use in about 98% of the brick and mortar hospital facilities across the country. That organization is led by a brilliant young man named Dejan Prokopov. Dejan had a vision to create an EMR that would serve the needs, all of the needs of operating a brick and mortar healthcare facility. And because he's represented in 98% of the hospitals, he can ensure interoperability of those systems across that ecosystem. Now, that starts somewhere. And I'd like to pose a question just for everyone to think about. There is an assumption of responsibility. The Bulgarian government and every government in the world has to answer one basic question. Do we assume the responsibility for the health and well-being of all of the citizenry? So every citizen within the country, does the government assume the responsibility for the health and well-being of its citizens? In Bulgaria, that's a very simple answer. The answer is yes. Straightforward, yes. Everyone who pays their taxes has bought into the National Health Insurance Fund for Bulgaria. And because of that, every single patient in Bulgaria has access to healthcare. Now, the difference comes in, of course, on the United States. The answer to that question is, well, kind of, sort of, yes, but not really. The reason why I answer it that way is because the United States has answered this question about the assumption of responsibility just for 5 groups and has facilitated programs for those 5 groups covering Medicaid, which focuses on those who are on the lower end of the socioeconomic scale. And then Medicare, which is for the elderly. And then, as one of my colleagues mentioned earlier, DOD and VA, there's the DHA, the Defense Health Administration, which provides healthcare services for active duty, and then Veterans Administration for military. So that's another bucket of people. And then there's two other buckets. IHS, which is the Indian Health Service. That is for the indigenous population of the United States, which we call Indian nations. And then, of course, the last one is CHIPS. CHIPS is the Children's Health Insurance Program. That's it. When it comes to the United States government, it is that carve out of the citizenry that the United States government has assumed the responsibility for. So that is one of the differences. However, what the United States has done is to, through regulation, through laws, through different programs, through statutes, ensure that there are standards being met across the healthcare industry. And that is very important because, as I mentioned before, the Da Vinci Project is focused on interoperability. So when we start talking about accessibility, we also have to understand the roles and responsibilities. So we've just now talked about the responsibility of the government, but what is the responsibility of the companies who are providing the healthcare services? What are the responsibilities of those organizations who are paying for those services? What is the responsibility of the patient and the family member? These responsibilities are very different depending on where you are looking, depending on the perspective of the individuals engaging with that system. So when we talk through the member or the patient's experience, we have to answer the question of role and responsibility very succinctly across all perspectives. As it stands today, patients are typically the recipients. They are a participant in the healthcare journey in that they are receiving services from healthcare and from all the different organizations involved in that care, as opposed to being an active member in the healthcare journey, an equal member of that overall experience. They are the recipients of what is being done to and for them. That perspective has to change in order to improve accessibility. The patient themselves is actually responsible for more of their healthcare than any of the rest of us, clinicians or hospitals or emergency rooms or what have you. The bulk of healthcare actually takes place at home. So if that is the case, then we actually have to empower the patient so that they can engage in the healthcare administration in a meaningful way. That means that the consumer engagement, the actual patient engagement portion, needs to include all of the tools necessary for the patient to improve their healthcare literacy, so that they can have informed opinions about their healthcare, so that they can help drive the impact of that healthcare and improve outcomes as they engage within the brick and mortar facilities and then carry on the responsibility of their healthcare experience once they return to home. The other thing that is very important, and of course the subject here is digital health, we have to leverage technology to improve healthcare with digital integration. Now, the reason why this is important is because of that concept that I just spoke of interoperability. In Bulgaria, it's fantastic interoperability that you have between the brick and mortar healthcare facilities. However, it is necessary for Bulgaria to develop the National Health Information System that it had endeavored to do, but unfortunately unsuccessfully, to truly build out a national health information system that is fully integrated, that allows for all of the data that is involved in healthcare journey to be aggregated in one place, accessible to all parties involved, and to be moderated and curated by the patient themselves. So that integration and the organizations that provide the systems and their ability to drive to best practices and standards for data formats, for interoperability, for data accessibility is really critical to improve the accessibility of the patient to the data in a streamlined and aggregated manner. The other things, of course, and I won't read all these slides to you, but the other things, of course, is making sure that there's operational efficiency and productivity and reducing waste. This is critical both in the United States and in Bulgaria. The concept of FWA, or fraud, waste, and abuse, is really to ensure that you have the right care to the right patient at the right time, and to reduce the overall cost of healthcare by avoiding redundancies in healthcare delivery. So, as an example, if a patient received an MRI or a CAT scan yesterday, that should actually be accessible tomorrow when they go and see their, in Bulgaria, GP, or in the United States, a PCP. It should be immediately accessible, and it should actually help drive some of the decision making there. You should not subject that patient to another procedure and have that redundancy and waste of services. A waste of services actually slows down access for other patients who need those critical procedures. Again, there are other things that bring in accessibility for the patient, things like SDOH, which is, excuse me, social determinants of health. ID and Strat, which is, your ability to dissect a population and stratify that population so that you can identify, hopefully using some predictive analytics or some predictive means, to determine what the best course of action is for a specific cohort of patients, and to drive better outcomes for that patient, instead of a retrospective or a reactive way, but a more proactive way, so that the decision makers can help drive improvements in outcomes. So from the Z Omega side, of course, we do this today for about 36 million patient lives in the United States, where we aggregate claims, information from EMRs, all the different labs, SDOH, different care management engagements, and we run rules against these things. We have machine learning and artificial intelligence, and we stratify the population and help drive the bulk of the resources to those who need it the most. So the catastrophic and advanced illness, complex risk, emerging risk, and then low risk. And then, of course, all of that goes into the outcomes of digital engagement, quality and compliance, workflow optimization, social care and engagement, care pathways, care planning, which is crucial. And then, of course, building upon the accessibility of the patient, better education for the patients themselves. And we do all of this through continuous high touch engagement with the patients and their family members, as well as coaching and a focus on wellness. Now, when we talk about the partnerships, and I'll wrap up here in just a second. When we talk about the partnerships and everything that we do, we invite all the people who are a member of the cluster to engage. We welcome partnership. We cannot do this alone. We need partners. We need partners to bolster the capabilities. There may be new novel techniques, novel approaches that we've not thought of yet. Yes, we have a brilliant group of people, but we are not the smartest minds in the world. It takes the collection of brilliant people and those motivated to seek that goal together, to come together and solution for the problems that impact all of our nations. Anyway, with that, I will wrap up, and I know we have time for discussion at the end. I welcome questions then. Thank you.
Thank you, Sean. Really appreciate these insights into how technology, down to the level of the base connectivity and interoperability, interacts, how the tech interacts with federal policy, and really like personal level decisions about division of labor and division of responsibility, and how that impacts health incomes. As you can imagine, that's quite personal for me living in the US. Please ask your questions in the chat. We will be answering them directly in the platform. So please go ahead and type those in, and you will hear from us directly. We are ready to find out what Bulgarian entrepreneurs are doing in this space and think about how we're going to partner. Our first entrepreneur is Yordan Ileev. Yordan is a digital health evangelist, an entrepreneur, and a strategist in the world of healthcare and innovation. He is co-founder and CEO of MySynergy, a digital consultancy providing IT services and solutions to the healthcare sector. Yordan.
Thank you. Just let me know when you have visual.
You are on. Go right ahead.
Thank you, Diana. Thank you, everyone, for being here. Hello, and my name is Jordan, and I'm CEO of MySynergy. We're an IT consultancy on the outside. MySynergy is a digital consultancy providing IT services to the to the healthcare sector. But at our core, we are healthcare enthusiasts committed to the betterment of patients' lives and well-being through digitalization. We exist to digitalize, enhance, and enable healthcare for all. Our commitment is to improve patient outcomes, to improve patient outcomes and the overall patient experience, and to make healthcare more accessible by empowering value-based healthcare initiatives and developing tailor-made digital solutions. It is our belief that ensuring the smooth flow of information across all points of care and operations in a manner that is efficient and sustainable to healthcare providers supports this ideal. With this in mind, that we created MyCare PSP. The system is razor-focused on improving the daily work of the professionals in charge of executing patient support programs. As such, our work has direct impact on the well-being of thousands of patients who suffer from incurable or life-threatening diseases worldwide. On the business side, MyCare PSP tackles what has been identified by the industry itself as the biggest challenges: long-term therapy adherence and patient outcome improvement. Also, there are often multiple similar overlapping solutions covering the healthcare practitioner and patient. This is true not only in Bulgaria, but also in Europe, in US, and everywhere around the world. So this multiplicity of platforms can be confusing when the key to the patient satisfaction is simplicity and consistency. Furthermore, this diversity of platforms can create a regulatory and compliance risk, given the challenge in tracking interactions. Other significant challenges in patient support programs are the tedious patient processing and different rules that each country employs when it comes to regulating patient support programs. You can imagine that every single country has different nomenclature, different legislation. So all these are really challenging to be handled by one single platform. Another challenge is the lack of knowledge and understanding of the patient support programs among the healthcare professionals, which is widespread, with the result that patients are not enrolled even when there is a clear benefit for the patient and for the healthcare professional in doing so. So these are the challenges that pharmaceutical companies must rise to. The good news is that the digital technologies are here to drive better healthcare professionals, engagement, and education. The outcomes that the pharma companies want from the patient support programs are the same outcomes that the physicians, the practice nurses, and caregivers want. And the pharma companies should involve the healthcare providers in the design of the programs and the supporting assets. This will both drive awareness and ensure that the solution meets the needs and expectations of the physicians, the health system, and ultimately the patients. But a patient support program in of itself does not offer differentiation. How exactly does MyCare resolve these issues? Of course, through its core functionalities. First, the system allows for a case-by-case patient tracking. Each PSP participant has its own profile in the system, which is associated with the therapy timeline, the overseeing doctor, the medicine type, and the medicine intake. Second, the system has two inbuilt features for direct communication with the patients: an integrated VoIP extension and a reminder functionality. In combination, these tools mean that an assistant within the company which runs the PSP can call or ping the participant when it's time for the next intake, or when there is a new regulation or document concerning their condition and therapy. All of this ensures that the prescribed therapy is being followed through by the patient. This example was identified by our clients as a key feature that was missing from their previously used systems. The ability to call patients directly from the user interface or vice versa and record the call and its parameters is something that differentiates our system from similar platforms. Additionally, the system is modular in nature. It's platform-based, which means that it can connect to different sources of patient information for remote monitoring, such as IoT devices and third-party applications. Clients are then able to analyze large amounts of patient data to gain insights for patient outcome improvement MyCare PSP allows for customized, well-designed programs that are tailored to individual preferences. Moreover, it has a consistent core comprised of uniform healthcare components, which can be deployed across various markets, granting business continuity and interoperability. It can be scaled, improved, upgraded, and deployed quickly and easily. This means that it is able to adapt to emerging challenges in a streamlined manner that puts industry standards front and center, both in Europe and the United States. By employing an intuitive design and a master repository with interchangeable health components, MyCare PSP provides a direct answer to the tedious patient processing and the different rules that each country employs when it comes to regulating patient support programs. Proof of our business and result-oriented approach is the initial rollout time of MyCare PSP, which took less than 4 months. We are confident that we can deploy the system even faster now. New patient support program onboarding time is currently 2 weeks, which is 800% faster than the initial launch. Another key advantage is the ability to scale number of clients, the volume of processed patients, and simultaneously running patient support programs. Of course, courtesy of the automation of the application lifecycle management, as well as the cloud foundation the system is built upon. MyCare PSP gives better access to patient data collection and interpretation and offers pharmaceutical companies an opportunity to design tailored solutions to meet the needs of different patient groups in a focused and caring manner. Finally, the fact that the entire user interface and functionality lineup were developed following real-world user feedback gives the system a distinct advantage over the competitors. Oops. This is the one. So MyCare has been developed in collaboration with SAT Health. It's a PSP contractor which specialized in patient support planning and execution. As such, the user interface as well as all key functionalities are derived from direct user feedback. That is to say, the system's interfaces and functionalities have been developed by its users for its users. In addition, best-in-class data visualization, courtesy of Power BI, allows for critical information to be displayed, granting management the ability to make intelligent decisions. This leads to a 30% decrease in the time spent on report generation, as cited by our clients. Overall, MyCare PSP is quick, responsive, and intuitive on the user side. What's more, our primary client reports a 100% satisfaction rate with regards to the interface compared to their previously employed system. The solution is built on Microsoft Cloud technology, including Microsoft Dataverse, Azure, Power Apps, Power Automate, and Power BI. And when choosing the system's underlying technology, we have identified several business outcomes that we wanted to achieve. And I briefly highlight them. Integration and interoperability. The design of the database and all interfaces are in compliance with HL7 FHIR standard, version 4. All integrations are implemented using Azure Web Services and Power Platform data connectors. Compliance, security, and identity management. We are using Azure Active Directory, Advanced Identity Security, and Microsoft Compliance Center audit logs across all services described above. Scale and quality. We're able to scale up fast with no compromise on security by using cloud services, and because we deploy Azure DevOps pipeline for application lifecycle management with a complex branching strategy, sprint tracking, and automated testing. And last but not least, a fast adoption. Using low-code and cloud technology give us the ability to deliver a low-cost, secure, and highly customizable product.
Jordan, thank you so much. This is really exciting work. You're handling so much complexity with such speed. Jordan is available for partnership, and we will give you contact information so that you can reach him. And please, while I'm wrapping up, you can look at his notes here. Please put your questions in the chat, and please please know that we will make sure that you know how to reach everyone here today. Our next entrepreneur is Ilyan Uzonov. Ilyan has more than 20 years experience in managing sustainable and value-driven business operations in multiple industry verticals, publishing with a focus on STEM, life sciences, pharma, and healthcare. Welcome, Ilyan.
Thank you, Diana. Glad to be here. Thanks everyone for attending. And of course, thanks for the organizers for having me. Bear with me to double check if my screen is visible. Just let me know if you can see it on full screen. Diana, am I visible? Is the slide deck visible?
Pardon, I was muted. Yes, you are good. Go ahead.
Thank you very much. So I represent OntoText. I'm heading business operations and sales across the world in our core industry verticals, life sciences, healthcare, and pharma. And I'm here to share our relevant experience in delivering actionable insights for big enterprises and organizations from the healthcare and pharma sector. So what we do in a nutshell, we help big enterprises and organizations that deal with diverse data, both structured and unstructured, to actually make a real good sense of those by creating reusable assets. We call those assets knowledge graphs, and I'll tell you what knowledge graphs are in a minute. But what they do, in a sense, is that they help organizations to leverage really deep analytics on top of both their structured and unstructured data. And of course, they can leverage profound insights to increase search and discoverability, and of course, implement data-driven decision support across the organization. We are helping organizations both make the most of their proprietary data, but we also enrich their data using both commercial data sources and public data sources. So why there is such a big hype around knowledge graphs lately? You can find them in Gartner or in Forrester. Everybody is speaking about knowledge graphs as a data hub that can actually give a totally new perspective to enterprises in order to management, but also consumption of their data. Because nowadays, very often organizations are actually using their data in a very isolated manner. They have siloed databases that keep different types of data assets. Like in this specific example, they have databases that are covering drugs or diseases, but those are not interconnected to each other. So with knowledge graphs, you can actually trace the data with its, tracing the relationships between the data points as per your specific use case. So for instance, if you are in drug safety, you would like to be able to trace the relationship between a specific treatment administered to a patient with a specific drug and dosage, and of course, whether there was a reported adverse event or not. If you are in drug R&D, you're interested in tracing the different and versatile relationships between targets and the drug candidates, between genes and proteins, or you can even go on a very low granular level and check information about gene expression data, molecular interactions, and many others. So in a nutshell, knowledge graphs introduce an entirely new way for working and consuming data on top of your siloed databases. It generally improves also the data literacy across the organization. And last but not least, it could be used in many different ways. It could be used as a traditional database that could be queried. It could be used as a graph so that you can run various types of network analytics on top. And of course, it could be used as a reference base on top of which you can generate new facts based on the data that you already ingested. So let me now tell you a bit more about one specific project with one of the leading children's hospitals. This is the Ann and Robert Lurie Hospital of Chicago, for which we help them to actually efficiently track the impact from their research activities. So what was the challenge for this organization? They were keeping data in, as I said earlier, in isolated data stores, data that covers the multiple aspects of each of their faculty members, because their faculty members actually had multiple roles. So they could be both physicians, they could be authors of scientific publications, they could also be investigators in clinical trials. And the issue is that all those data points are actually coming from different data sources that are not interconnected to each other. So we help them to get this unified access on top of this data so that they can trace efficiently the impact of the research activities of their faculty members. So the solution that we built, of course, uses a knowledge graph beneath that introduces these relationships between the different data points. But we also used not only the hospital proprietary data, but we augmented this data with some relevant insights that we extracted from public data sources. Data sources for instance, clinical trials, data sources from scientific literature, as you will see below, and many other relevant data sources that, in a way, provided a much broader context around the research activities of their faculty members. In this way, we help this customer to create a much wider, we call this, physician or doctor 360 view on all the different activities that are performed in this organization. The approach that we followed is that we developed and fine-tuned according to the specific use cases and requirements from the business stakeholders, a really powerful analytical dashboards. So you can see here on this slide just two visual diagrams. One is representing clusters of co-authorship networks. So basically those are people that are publishing something on a specific topic, and they're actually doing it, in a joint manner. So in a way, this data analytics provides also a tool for research organizations and hospitals to also define the specific key areas of research for them in the next years to come, to also evaluate the trending topics or the areas that they want to be prominent. And of course, last but not least, to efficiently evaluate the impact of their individual researchers, because it was really important for them to trace down the relationship between a specific research activity and, for instance, direct application in the medical guideline procedures in pediatrics. So we done this using sophisticated instruments for semantic data integration, as I said earlier, leveraging both the proprietary data of the customer, but also enriching the knowledge graph with public data sources using, I'm sure you know all those resources like PubMed or clinicaltrials.gov, or resources of the National Institute of Health, Crossref, and many others. So at the end of the day, this is a live product that is deployed in production and helps Lurie Hospital to efficiently evaluate the impact of the research of their fellow members. And as I said earlier, it also in a way determines the direction in which their research activities are to be focused in the next years to come. So let me just finish by outlining the main differentiators of On2Text. So we have unique portfolio, which is, on top of very solid products. As I said before, we are behind one of the most widely used graph database technologies for building enterprise knowledge graphs. We do also have a platform that provides solid capabilities for text and data analytics. We are extremely, focused in specific verticals. As I said, pharma, life sciences, and healthcare are quite key for the company. We do have subject matter experts that can understand the domain and the specifics of the use cases that we tackle. Of course, we are standard compliant, which is really important in tech, so that we can make sure that everything is interoperable and the data could flow according to the specific standards in a secure manner, of course. We also offer unmatched expertise across different disciplines and verticals. When it comes to technology, we are one of the leaders in knowledge modeling, reasoning, text analytics. We also use a lot machine learning and deep learning approaches. And last but not least, we have built a really solid ecosystem of partners that are both tooling providers, technical vendors, system integrators, and global consultants. With that, I would like to finish, but I'm actually looking forward to your questions at the end of the event.
Thank you, Ilyan. Everyone, please do put your questions into the chat. That is how we will receive them, and we will find a way to address them. Ilyan, this is such powerful work. The knowledge graphs and that 360 view can deliver so much insight. Partners, look to Ilyan. We'll make sure you know how to reach him. Let's turn our attention to Dimitar Dekov. He is CEO and founder of BI, a business intelligence, that's EYE, BEYE. That's a business intelligence company specializing in data analysis and visualization. Today, the company has expanded its range of services, providing agile planning and modeling, RPA, and advanced analytics solutions. Dimitar, take it away. I think you're on mute.
Thank you, Diana. Just give me a second, bear with me. I'm sharing a screen right now. Okay, and I hope everyone sees it. Hi everybody, my name is Dimitar Dekov, and today I will be sharing with you how data and analytics can improve hospital performance. We're happy to be part of this initiative and work together towards the digitalization of the healthcare industry. So let's begin. BI is a data analytics and connected planning solutions provider. We help our clients become more efficient and data-driven. Our tools are used by over 5,000 employees globally and save over 30,000 hours of manual labor every year. Our clients are leading healthcare providers and life sciences companies who use our services to support the journey to save lives and care for people more efficiently. We have two major clients in the US, a medical devices leader listed on the New York Stock Exchange, and a company that's revolutionizing cancer treatment listed on the NASDAQ. So what is the problem that we address? As a perspective, in 2019, in the US healthcare industry, it is estimated that all this healthcare industry was worth over $3.8 trillion, or that makes about more than $11,000 per person per year. As a share of the nation's GDP, healthcare spending accounted for over close to 18%. By far the biggest spending item. Just think about it for a second. Of every $100 of output in this country, almost $11 go for healthcare. With over 900 million yearly outpatient hospital visits, hospitals produce an estimated 50 petabytes of data per year. This massive information comprises clinical notes, lab tests, medical images, sensor readings, genomics, and operational and financial data. 97% of this data is estimated to be either unused or underutilized, with the 3% being used mainly on financial and claims analytics. But this is about to change. In the extremely fast-paced work environment, doctors don't have time to build or even request reports. They must take decisions on the spot with precision and care. And this is where data analytics comes into play. Embedded analytics can produce significant value for hospitals. Electronic healthcare records systems are undoubtedly the most critical source of data in the healthcare organization. However, data complexity, lack of speed and usability, lack of interoperability, query-based limitations, and time-intensive reporting they all hinder the decision-making process. Through embedding analytics directly into the EHR systems, hospital staff can uncover new insights, promote better clinical and business decisions, better manage their costs, and use their time more efficiently. And although healthcare executives globally are recognizing the importance of integrating EHR systems with analytics, according to a recent research by Click, 46% of physicians say that EHRs don't have all the data and functionality they need. It is proven that it is 15 times more likely somebody to use data when it's part of their workflow. We have seen multiple benefits of embedded analytics, like improved patient engagement, reduced readmissions, and eliminated clinical variations. Not only that, but getting full visibility of patient activity and analyzing demand for service enables healthcare facilities to react quickly so they can maintain excellent access, optimal utilization, effective patient flow, and satisfy patient and physician expectations. Recently, we had an inquiry from one of the world's top 10 university hospitals in Switzerland. Their cardiac surgery clinic struggled to capture all available data in one place and make it accessible and useful for the hospital staff. We gathered the scattered data from their EHR system and embedded a dashboard to have all data readily available in one place. This multifunctional dashboard supports physicians' weekly board meetings where they discuss all patients' conditions and decide on the type of procedure and the level of urgency. Previously, it was a time-consuming process that needed manual data extraction. Now, our analytical tool enables them to analyze patient symptoms in depth and make informed and timely decisions on the most appropriate approach and the type of surgical procedure that should be performed. Our solution also helps the hospital answer the questions like, what are the most common treatment methods? What are the trends and variations in length of stay by diagnosis-related group? What is the average bed turnaround time by hour and day of the week? That's to optimize the capacity and performance of operations rooms. What is the patient readmission risk versus days from prior discharge? What materials and resources are consumed and by whom? This is to monitor their clinical supply chain. The medical management of this clinic uses this data together with the real-time dashboard to decrease clinical variation in surgical procedures. They also uncovered significant variation in the length of stay. With the help of our solution, they were able to identify and implement standardized best practices, including reducing waiting time for procedures, reducing the rate of reoperations, and increasing their surgical capacity. We at BI are proud of the progress that has been made to assist hospitals in becoming more data-driven. And we are excited for the future as we see more and more organizations embracing analytics and basing their judgment on data and their insights on data. I will be happy to take questions now.
No, I'm sorry, Dimitar.
Later.
We're going to do questions later.
Thank
you so much. Just imagine when I imagine having those analytics at my fingertips to make decisions. That's a really different experience. Thank you so much for bringing that work. Our next entrepreneur is Ivan Lukashev. He is CEO and mastermind behind one of the leading European digital health companies, BGO Software. Ivan is focused on helping health service providers design, develop, and implement impactful technology solutions which deliver value and better patient care. Ivan.
Thank you, Diana, for that very kind introduction. Thank you for having us today, everyone. It really is a pleasure to be able to talk in front of you. So today I was wondering, like, what should I be talking to you about and how could I create like the most value for you guys? So I decided to take a different approach and decided to tell you about how we came about to do what we do currently. Now, we're a company that helps other organizations build their digital health solutions. And after the COVID-19 pandemic, I think that all of us felt that beneath the surface, the approach to solving problems, especially in the digital health space, has changed a little bit. So we try to sort of come up with a offering to our clients that would enable them to take better decisions, would enable them to make better solutions. It's not a secret that there is virtually hundreds of thousands, if not millions, mobile apps on the market nowadays, but only a few of them are exceptional, and only a few of them the users are willing to pay for. Now, the question is, why is that? I want to share with you some findings that we stumbled upon in some research that we did over the recent couple of years. Now, I'm going to tell you just a little story here. With two friends of mine about 2 years ago, we decided to take on a challenge. And this challenge was to come up with a marketing strategy that doesn't cost us anything, but would be really effective for us. So what we decided to do is we decided to choose about 50 top business leaders in Bulgaria, in our country, and to approach them and interview them. Now, before you take it to the next slide, whoever is running my presentation, because I'm having a little bit of technical difficulty, please just hold on until I let you know that I'm ready to go to the next slide. So, right. So about 50 people we decided to interview. So technically what we did is we just opened a couple of business magazines like Forbes, like Manager, and we selected about 50 business leaders that we invited for an interview and approached them with one particular question. And that question was, if we were a member of your team, if we were like an employee of your team, what would be our job and what would you need us to do? Now, what happened is that myself and the other friends that we were doing this like experiment with, we divided the 50, almost 50 business leaders in like 3 equal groups. So each one of us interviewed about like 15 to 20 people at a time. And then we got all the results and we analyzed those results. And what I'm going to be showing to you now is the questions, the most interesting questions that we asked. I mean, we asked a lot of questions, but since we don't have enough time, I'm just going to go to the most interesting stuff. So we asked those industry leaders. So describe the IT team of your dreams. So 80% of those people answered that the IT team of my dreams is one that actually cares to understand my business. Now, you know, that was really interesting to us because when you think of an IT team, you think of, you know, like a bunch of developers, IT professionals that sit on a computer and actually produce like code, which eventually turns out to be a web or mobile application. But what like grabbed my attention was the fact that those people wanted, I mean, none of the questions, none of the answers that we got actually had to talk about code. And all the answers that we got had to talk about creating value and actually understanding the business of the client, right? So as I said, the 80% of the answers that we got was actually that the IT team of our dreams is one that actually cares to understand my business. And I'll tell you in a while why it's important. If we can go to the next slide and the next question. Now, next question that we ask, one of the next questions that we ask is, what is the number one job that your IT unit should do for you? So 60% of the answers that we got were that it needs to generate value for my clients. Now that sounds quite straightforward, you know, like need to generate value for my clients, but how do you understand what gives value to your clients is actually the main question. Moving on to the next slide, please. Right, thank you. Who should your IT team work with the most with? And this was something that at that point of time really impressed me. Almost 60%, as you can see, of the answers that we got is that the IT team should actually work directly with the client. And this was really like a game changer for us because until that point, it was more or less natural. And I'm sure that many of you guys that are involved or have been involved in building an IT project of some sort, there is what happens, like if you have the table and you have on one side of the table the client, behind the client you actually have their end user. So it is the end user talking to the client. And on the other side of the table, you have the IT team. So what happens is that the IT team talks to a client who is supposed to understand the end user and transmit the message to the IT team, which actually doesn't make sense. I mean, why should you have one more person between, or one more group of people between the person that's going to be building the software and the person that whose requirements should be met? Imagine that you want to build a house and the architect of your house is not talking with you directly, but is talking with someone else who you are talking with. There's a great chance that some of the requirements will not be met, or there's a great chance that things will change in the communication. In Bulgaria, we have this child's game called broken telephone, where you have like 10 people like sitting in line, and then the first one whispers one thing in the ear of the second one in the ear of the third one, and by the time that the message reaches the 10th person, it has completely changed. So this question and this answer that we got at that point of time pretty much reminded me of that game a lot. I'll tell you why that matters in a second. If we can move on to the next slide, please. Right. How does your IT team create the most value for you? And over 50% of the business leaders actually replied that not having to deal with my project would create the most value for me, which actually makes so much sense. I mean, you know, like when you're a business person, you don't really need to get into details of how to have your project like delivered. So all you need to do is decide what the results you need, and then eventually, you know, have somebody like do the work for you and you get the results. You know, like most of the people, actually, we had a question like that. I don't remember the exact numbers, but most of the people said that they don't really need to know like IT stuff. They don't need to understand the IT people. They just need to get the results. You know, like you have your house built. That's what you need. So moving on to the next slide, and I think it's the last one, if I'm not mistaken. How does your IT team create the most value for you? You can see like almost everyone answered to us that driving the project forward for me so that I don't have to is the thing that can create the most value for any business leader. Now, I think this is the right time to talk about like difference between a company providing IT services and a company providing let me rephrase, an IT company providing IT services and an IT company providing business services. There's a considerable difference between both. And I think that it's quite straightforward, you know, like an IT service is having a program done. A business service is telling you, you know, like we will drive your project forward, we will understand what you want, and we will find a way to have it delivered to you. So that all you have to do is answer our questions and eventually pay the bill. Now, the ultimate outcome, we didn't do much business after doing this like genius like marketing strategy at that point of time. But what happened is the fact that I particularly in that case came to talk with my colleagues about like our findings. And what we created was a business service that we called CTO as a service, a project CTO as a service for those clients that had a CTO already like on board, and it's like CTO as a service, like you know, two CTOs as a service just doesn't work like that. So we created a service which we called Project CTO as a service, which is a business service in per se. Now, what does a CTO as a service do? A CTO as a service does everything that we saw in those slides, you know. So it drives the project forward for you. It collects requirements. It talks directly to the end users. Yes, Anna, you look like you want to interrupt me because my time is over.
Indeed.
You're right.
Good read.
Cool. So yeah, if somebody wants to know more, I will let you know, guys.
Perfect.
I mean, I'm available for questions. One thing that
Great.
I think is important for everyone. Success doesn't look like a straight line, guys. And this is really important, especially when you build your projects.
Thank you, Ivan. Beautiful customer discovery process that you went through. It's very interesting and surprising.
Wasn't
that
intentional.
We want,
Wasn't intentional.
We want IT teams to work really directly with the client. I would not have expected that. But when I think about it as a game of telephone that you can solve with CTO as a service, that's very interesting. Really appreciate it. Our last startup today is led by Venelin Dimitrov. He is the founder and the chief executive officer of Soft Group. His IT voyage begins more than 20 years ago and determines his in-depth technical knowledge in software engineering. I believe we're going to start with a video. Let's put that up. Great, I can see it.
Hello, everyone. My name is Venelin Dimitrov, and I'm founder and CEO of Soft Group. I'm going to present you the topic from serialization to digitalization and transparency. First, I would like to say a few words about me. I have master's degree in computer science and more than 20 years of experience. I have strong expertise in software, mechanics, electronics, pharmaceutical production, and regulations. About our company, Soft Group, we are a software company founded by me 18 years ago. Our focus is on the pharmaceutical domain. Our main business is serialization, aggregation, and track and trace software, where we have a complete vertical solution. However, the track and trace would be a complex at first sight. Our entire expertise helps to define the role of serialization and traceability relatively easily. The serialization is the first step towards completing the traceability of the supply chain. Thanks to assigning a unique code to the packaging of each drug and printing this code on the packaging, we ensure full traceability and 360-degree visibility in the pharma supply chain. As I already mentioned, this is a challenging process. Some of them are adoption of the existing equipment, business process, and IT systems. The perfect solution is this one that is a reliable end-to-end traceability system, which has all the advanced data management, flexible interaction, seamless integration, data protection, and prompt reporting to the authorities. The benefits of the supply chain traceability are various. They started from the protection of the public health and continue through prevention from revenue losses, brand protection, supply chain visibility, and transparency. I should mention that there is a different track and trace regulations around the world. SOAP Group has excellent expertise in the field. We have clients from all over the world, and we successfully faced the different regulatory frameworks. In this regard, the enforcement of common standards, as GS1 is of great value. GS1 system standards strengthen the regulations, permitting the full interoperability and compatibility. And where SOAP Group stands in this picture? We support the pharma industry to reduce the supply chain complexity. Our role is to provide a solution that complies with major and emergent compliances and doesn't affect the existing production processes. In our company, we like the actual proof. Because of that, we would like to share with you a particular case of our client, FitFarm. In this case, SOAP Group provides a fully automated packaging line with track and trace solution. We provide a solution in full compliance with Russian and European regulations, with high production speed and less than 1% rejection rate. Meantime, we achieved secure communication between all third-party systems with user-friendly software available in the client native language. Another struggle of the industry is the digitalization of the supply chain. Our role is to provide flexibility in the solutions, speed up the laboratory process, and quickly adapt the evolving regulations. We also provide integration that help automated processes and reduce paperwork, increasing production efficiency with the real-time monitoring. That's all. Thank you very much for the attention and have a great day.
Няма звук. Pardon me, I was on mute. I had such a lovely conversation with myself.
Yes.
Thank you, Venelin. I would love to hear from you. First, I want to tell you, I really appreciate what you're doing to make me feel safer about how things might come into my healthcare. What would you say is, what would you like to hear from potential partners? Who's the ideal partner for you, and what is the most important thing for them to know about you?
Cool. So the perfect part, not the perfect partner, the useful partner is a partner who have a contacts insight into the pharma producers. So this is the only condition that maybe if we have conditions, this is the most important one.
Mm-hmm.
So we cannot just go and speak with the companies. The biggest companies, you cannot just enter into the headquarters. We need the partners that can help us to make a contacts inside. This is the most important thing. So for us, it's very important to have this type of companies. They are like, for example, other vendors for equipment or software vendors. Never mind who and what they're doing. They just the things that we need is good contacts insight into the pharma companies. We're selling directly to the pharma producers, so we need exactly this.
Got it. So the first stage is going to be to partner. It's a very ecosystem type of play.
Yes,
You're looking for relationships with the people who are serving the pharma companies, so that you can follow them into those conversations and perhaps work together with them to serve pharma. Great.
Yeah, thank you for clarifying that. So yes,
absolutely. Is there any particular type of pharma or any particular type of drug for which you are especially useful?
At the moment, the regulation in Europe is only for the prescripted medicines, but it coming also the OTC products, the food supply ones, and a lot of industries are ready to come after that. So at the moment, the interesting companies is this one that producing the prescripted medicines. But this will gonna change it very soon. So yeah, all of the pharma producers are interested for us.
Great. Well, thank you so much, Venelin, and thank you to all of our entrepreneurs. Let's bring you all back into the speaking area. I'm going to ask one question, and as we close here, I'd love for each of you to answer, and I challenge you to answer in a single sentence. Here's the question. What do you see as the most urgent need to facilitate the collaboration between these two markets, specifically the US and Bulgaria? Let's go. I'm looking for hands to see who to go first. Otherwise, I'm just going to go in the order I see on my screen. Okay, great. Sean, go ahead. One sentence, please.
No problem. I think education is most important. We have to know who you are, what you have to offer, your ability to scale and support your initiatives across the pond. So education is the key to collaboration.
Great. Education is the key to collaboration. And next, I see Jordan.
Thank you, Daniela. I think that one of the key benefit that one company should have is the need for scale. If you want to scale and you're open-minded, you need a collaboration. It's going to be a technological or a business collaboration, ecosystem collaboration with a cluster. You need to be open-minded and you need to be collaborative. Building products with companies from the ecosystem brings a lot more value.
Indeed. And that need for scale, I hear what you're saying. That need for scale drives a hunger for collaboration. We all understand that. Okay, great. Next, Dimitar.
I think it's visibility, it's trust, and this is how we build great collaborations. Those two things.
Beautiful. Visibility and trust. Thank you. Ilyan.
I would say validating the technology that we deliver against specific business needs, because as I said, we have subject matter experts, but it's really important for us to validate the technology and it delivers tangible value to the customers and solves real life problems. So I know that traditionally the educational system in US, it's much more business oriented. So we are more on the other side, more techy and in terms of nations. So we could definitely, help each other a lot.
Beautiful. It's
meeting
validating
technology and business needs.
Got it. Yes, that combination of both the tech and the business side. Thank you. And Ivan.
I think that the key word here is added value. So each company on both sides should be able to answer the question, how do I create the most added value for the other side?
Added value. Great. And Vanilin.
Yes, thank you. So with Bulgaria, we have strong expertise in the pharma domain and in IT industry. So this could be very useful in the US.
Connecting the place with the expertise with the place with the need. Beautiful. Eliz, thank you so much for organizing. And would you like to say one last sentence before I close out the day?
Absolutely. Thank you so much to all the speakers. I personally learned a lot. We do have a lot to offer in Bulgaria. There's a lot of expertise. We are often advertised as the IT guru place, especially in the capital region. But I just want to say something, and I think the added value, the trust, the recognition are all important. But I'm a strong believer in relation building. So if we have the perfect product and we don't know how to offer it or how to promote our product, then it's kind of like pointless. Or if we don't know who to reach to make that connection or introduction, then we can be just stuck with our product and our services. So therefore, I believe great network of connectors and also promoting the product, but also doing a little bit the business mind, as Ilian already mentioned, the business mind set up in the United States that we look for, how to advertise, how to make it more visible, how to make it more accessible, and how to connect their need with our solution. So I think that's the key. Sorry, there is a feedback. And that's what I'm going to say. So good luck to everyone. And thank you so much for joining. And hope we'll get, each of your contacts and invite you to more collaborative events. Thanks.
Thank you. I see so much opportunity here. Together, we make digital healthcare accessible. As we close, I would like to point you to the healthcare value chain that this group has created with very concrete and accessible digital health solutions along the patient journey created by Bulgarian companies. You can find that at https://dhicluster.bg/y-Bulgaria/ And if you didn't follow on all of that, we will make sure that you get the link, and perhaps we'll even have a QR code here on the screen in a moment. We'll follow up. We'll send you that link. We'll send you contact information for all of the companies and the hosts and your moderator. Thank you for coming. This has been really eye-opening for me, and I see all kinds of possibility in this bridge between Bulgaria and the US, just as a start for the meta ecosystem. Thanks so much. Glad to have been with you here today. Looking forward to seeing you at the next step in this initiative.
Thank you. Bye.
Thank you.